Councillor Duck. We are then going to hear from Chief Hubert Watt from God's Lake First Nation. We're then going to ask Assembly of Manitoba Chiefs Grand Chief Kathy Merrick to speak. MKO Grand Chief Garrison Seti will then be called upon. Assembly of First Nations Regional Chief Cindy Woodhouse will be speaking thereafter. Grand Chief Walter Westicoot from Keewatin Tribal Council will be speaking to us, and then we will hear from Grand Chief Jerry Daniels from SCO, and then we'll have some opening questions, or we'll be opening for questions after that. So if we can please call up first for a prayer, Councillor Duck, if you'd like to come up here or do it from where you are. Thank you for that, Councillor Duck. If we could please have Chief Hubert Watt from God's Lake First Nation come up and speak.
Good afternoon. On October 3, 2022, the Council and I have decided to declare a state of emergency on illicit drug use in the community. It's very rampant. It's causing a lot of problems in the community, a lot of stresses. Families are broken apart. People are getting sick. People are dying. We have reached out to ISK Health, ISK RO for help years and years. We haven't heard anything promising from them. All they want to do is keep talking and talking. Now is the time to act on this emergency. And I know a lot of First Nations are going through the same thing we are. And I pray for them, and I pray for our community. We need help. We can't have any more meetings. We need action now before we lose more people to these drugs, to suicide. On a daily basis, our health staff are going on calls. Our staff are basically working 24 hours a day trying to help these people that are suffering, that are dying. And there's just enough talk from ISK, from the government, saying we're going to do this and that. Now is the time for them to act. We're pleading for your help. And we want the understanding of the people in Canada on what we're going through. There's a lot of things tied into these addiction problems. Residential school, 60 school, day school. Our people have gone through a lot of abuse, physically, mentally, emotionally. Now is the time to produce some action to help heal the people in our community. Egi, mamit nin tumanuma. Egategi ne peus nano, wichi on, ete potsigatik, dawi on, ete potsigatik. Kol stop water, te potamak wichi on. I've thought a lot about this before we declared this state of emergency, that we cannot be embarrassed, ashamed of the problems our people are having. The epidemic of mental and emotional abuse, that that are going on generation to generation from the residential school. We're still feeling the impacts of it. I myself am still healing from it, trying to heal, and a lot of our people are. So we need help, we need action from the government right now, today. We can't continue to keep on dying, keep getting sick, and being a statistic. We need action right now. And I challenge the government, ISK, to produce that action right now. Enough is enough. Thank you, sir. Thank you.
Thank you very much, Chief Watt. If we can then call up on Grand Chief Kathy Merrick to speak.
Iwasanin na naskumun epise mama wiyaki tigegone piani mutamak. I acknowledge the Treaty 1 territory that we are standing on today, and I acknowledge Mother Earth today. I acknowledge all the leadership that are here, all the Grand Chiefs that are here, and the support that are here, and that we come here today to speak in a unified voice for all the chiefs in Manitoba. God's Lake First Nation is in a crisis from drug use of epidemic proportions. In this nation of 1,500 citizens, 20 to 30% are experiencing drug addiction. This crisis is the result of intergenerational trauma and the failure of the colonial system to react and prevent this consequence. Due to years of inadequate funding for accessible mental health supports, addiction treatment, primary care, education, housing and recreation, God's Lake First Nation and their citizens are experiencing a humanitarian crisis. God's Lake First Nation is in desperate needs of immediate interventions from both provincial and federal levels of government to immediately provide life-saving supports such as crisis response teams, mental health supports, and nursing human resources for the nursing station. On behalf of Chief Watt, MKO, and KIM, AMC reached out to ISK 4 days ago to get emergency access to highly trained professional and supports to assist our First Nation and provide life-saving provisions, but was denied a meeting and resources. The ask for the Canadian Red Cross to be utilized was also initially declined. The only recommendation that was given by an official at ISK was to send God's Lake First Nation AMC ambassadors who do not have the ability to provide the services that are required. As ISK has sat idle over the last 4 days, how many more First Nation citizens have suffered a loss or lost their lives? God's Lake First Nation has bravely come forward to share their experience that many of our First Nations are also struggling with. It is evident to First Nations leadership that the failure of government is manifesting systematic racism to react to the needs and the rights of First Nations. Failure of the government to allow First Nations to exercise self-determination and implement sovereign health initiatives is a barrier to First Nations citizens' health and holistic healing. We have heard directly from First Nation leadership for years that this substance abuse crisis is something that they have been dealing with for years. The Island Lake Tribal Council has denied was denied resources to construct a First Nations addiction treatment center for their citizens. It was reported by ISK that Ottawa has decided the project is not a priority for government funding. And at this time, all funding resources have been committed to other priority projects. God's Lake First Nation is here today to ask for those exact same services for their people. The response from the government should not be to the response to Island Lake Tribal Council. All our people feel the pain and the hurt in our communities when it comes to our young people that are doing the drugs and the alcohol. We need time for intervention from the governments to assist God's Lake First Nation, to provide treatment centers for God's Lake First Nation, to provide healing centers for God's Lake First Nation and all our nations within Manitoba that ask for this service from the governments. So the governments, you're on call today from all the chiefs of Manitoba to be prepared to provide those services for our people. Egosane.
Thank you very much, Grand Chief Merrick, who stole my agenda. Thank you very much. If we can then now call on Chief Garrison, Grand Chief Garrison Seti. Thank you.
Thank you very much. Tute magnitisanak niwagumaga nagitamiskat na onut sagisigak. It is my honor to be here and to stand in solidarity with the God's Lake First Nation as they are addressing a crisis within their nation and with their people. And I want to welcome our Grand Chief from the Assembly of Manitoba Chiefs, Kathy Merrick, and Grand Chief Daniels, my colleague, and also Regional Chief for standing with us along with Grand Chief Wastescugut. And on October 4th, God's Lake declared a state of emergency to address the drug abuse issue in their community, particularly crystal meth, is going to First Nations. And it is alarming and it is shocking that there has been no response to this declaration of emergency. And it is gravely concerning to us as leadership that represent these nations. The lack of government response to the call of the state of emergency from God's Lake is unacceptable, because we know that if there's no action taken, people will die, and people have been dying in our First Nations because of the epidemic that we're facing. We have inadequate public health services in First Nations, and the use of unsafe drug use is causing havoc in our First Nations because they don't have the resources to deal with them. So what we're facing in these First Nations is not lack of leadership. It's not because the leaders do not want to act. They know what to do. They know what needs to be done, but they do not have the resources to do so. And that is why we're calling on the government to make sure they take immediate action in providing the necessary resources for this nation to address their crisis. We cannot stand back. We cannot sit idle and watch this nation go through this crisis any longer. The governments have to act, because it is inhumane, it is immoral that governments look the other way when the leadership is calling a state of emergency and nothing is being done. So we call upon the governments for immediate support for God's Lake First Nation And we expect immediate action, because today it is unacceptable to watch our people go through this, because our people matter to us. Our people need to be protected. Our people need to be healed, and we cannot do it by the inaction of governments, and we demand action today. We demand action now. Egusi.
Thank you, MKO Grand Chief Seti. If we can now hear from Assembly of First Nations Regional Chief Cindy Woodhouse.
Well, thank you, Councillor. Thank you for the opening prayer this morning, Kichimigwech. And thank you to Treaty 1 for welcoming us onto their territory. You know, day in and day out, I'm always so thankful for Treaty 1 and, you know, Treaty 5 for being here, as well as God's Lake First Nation. Thank you for coming forward, and for, you know, my heart's with you all, with each of your families as you deal through this humanitarian crisis. You know, I also want to thank Chief Clarence Easter, who's with us here today. Of course, my colleagues, you know, Grand Chief Merrick, Grand Chief Daniels, Grand Chief Seti, and Grand Chief Westasekut Kichimigwech. Thank you, and I know that we all have to work together. But I know that you know, I concur with, you know, what my colleagues are saying. I know that many times, you know, like, this community is asking for support, asking for help, and they're coming forward, and it's falling on deaf ears, and they need support. And so we call upon Manitobans, the Manitoba government, Manitobans themselves, to, you know, and Canadians and the Canadian government to look to this community. They're asking for your support. They're asking for, you know, to be partners with us. And that's what, you know, that's what reconciliation is. Not always easy, but it's these conversations that need to be had, and action needs to follow it. And I know that, you know, the experts are here. You know, there's so many things that we can talk about. You know, we've heard from leadership these past 2.5 years that the pandemic as well has been one of the main reasons meth and substance abuse has been rising in this community. If a person needed resources or assistance for whatever reason, they were not able to obtain that help. But because of the isolation, the lockdowns that were in place, treatment that went to video or to remote access for healthcare, God's Lake First Nations is one of the many First Nations in this province that have seen what the after effects that this pandemic has created. 30% of people living in this community are abusing substances and altering the way of life of the First Nation, not just now, but for many, many years to come. The health effects of substance abuse will present themselves as late-stage chronic diseases that will be a direct result of the community's current state. So we need governments to work with First Nations and to work with God's Lake First Nation to create community-based solutions. So we're calling upon you today. Now we hear that COVID cases are rising in this First Nation again, and leadership is concerned about potential outbreaks. With these COVID numbers on the rise, how do you then protect the patient, the staff, and the citizens, and to make sure that the First Nation is safe? How do you deal with people that maybe refuse care as they present themselves to the nursing station under the influence? As the numbers of people using substance increases, so does the possibility that the number of communicable diseases will also increase. We need Canada to work with our First Nations leadership to understand the scope of services needed to address the state of emergency that was declared by God's Lake First Nation leadership and those that are in attendance here today. It is imperative that Canada and its departments work with leadership with urgency on providing supports and addiction treatment programs on and around First Nations so that we can release meth grips on these First Nations communities. Everyone in these First Nations are being impacted. Families are being broken apart. We have so many people in our First Nations with a lot of opportunities, but substance abuse is getting in the way of that. We need to resolve these problems in the First Nations rather than sending them elsewhere where they are not connected to their land, their language, their culture, and their identity. We need to see these long-term specialized treatment options and create safe and healthier places to live for our First Nations people. And I'm also going to say this. I know it's not in my notes, but it's in my heart. You know, to all you drug dealers out there, stop. You're hurting people. Thank you.
Thank you, Regional Chief Cindy Woodhouse. If we can now call upon Grand Chief Walter Wesestikut from Keewatin Tribal Council.
Thank you. I don't know if she's calling me names or just saying my name wrong. My name is Walter Wesestikut, Grand Chief of Keewatin Tribal Council. On October 3 of this year, 42 days ago, God's Lake Chief and Council declared a state of emergency in our community. Let that sink in for a bit. 42 days ago. On October 27th, I sat with them in a boardroom at the Indigenous Services Canada's office on Hargrave. At that time, I reminded ISC that they were responding to a declaration 24 days after the fact. Now, 42 days later, there is still nothing happening. You've heard leaders talk about racism. This country was built on racism. There's no getting around that fact. When the settlers came here, the colonizers arrived here, they came here with their institutions. Those institutions are still harming our people today, killing our people, tearing families apart. I sit with the chief and council and hear their stories. They talk about people committing suicide. They either can't get away from the addiction or they can't help those loved ones that they have. Children being removed from homes. 42 days after a declaration on a state of emergency in their community. I don't know where in the world it is acceptable to wait 42 days and watch your people succumb further into the depths of their addictions and everything that entails. There is a lot of human suffering in this community today as I stand here and address you. For some reason, the government of Canada, the government of Manitoba, they don't appreciate that. And that's been clear from their inaction. We don't know yet how many people will be lost since October 3. We had a meeting this afternoon with bureaucrats. There were no political leaders in that room or on that screen. The political leaders could have taken the time to sit behind a camera and listen and participate as people sat in that room to explore options and solutions. Just silence. This is 42 days after a declaration. Just like that silence you just heard. as Canada and Manitoba doing nothing to help these people that are suffering right now. I applaud Chief Watt and his council for what they have been doing. I applaud those that have stood and supported them, those that have sat with them and listened, those that have offered solutions. We wait on Canada and Manitoba to come forward with solutions with some concrete action to help stop the suffering in our communities, to help stop the suffering in God's Lake First Nation, to help stop the breakup, the further erosion of the family system in God's Lake Narrows. That was it.
Thank you very much, Grand Chief Wustesakut. Did I get it right? Thank you. Now I'd like to call on Grand Chief Jerry Daniels, please, from SCO, Southern Chiefs Organization.
Bonjour. It's a beautiful day, and we're thankful to our Creator for another blessing. I'm here to support Chief Watt, the Council, the Elders, and all the Grand Chiefs that are here. There's a crisis happening throughout the territories. It's been going on a long time. It's a symptom of the poverty, the systemic barriers that have been imposed upon us for many decades, and requires an allocation of resources and a focus on moving when it comes to mental health and when it comes to addictions. We need to stop the flow of our children and our young people into addictions, and we need to have healthy and successful treatment programs, land-based and others that work. And we need to support the community, God's Lake. We need to support the people who are suffering. And it needs to be made a priority. The conversations around strategic decision-making within ISK, the formulas that are utilized for decision-making, need to be put into the hands of leadership, Indigenous leadership, First Nations in Manitoba. And we're here to show our solidarity and our unity with the communities and with throughout all of Manitoba, and really across the land, because this is something that affects all of our children and all of our families. And the solutions we have to work on together, and hope Canada and Manitoba understand that, and how important that is. So with that, thank you for giving me some time, and we hope that things move very quickly, and hope the bureaucrats in Ottawa and those in the regional office and in the province are listening to us. This is a priority and needs to happen now. Thank you.
Thank you very much, Grand Chief Daniels. At this time, I'd like to open up for any sort of questions that anyone might have here today. If you wish to come up to the mic, please do so, or I can repeat.
Chief Watt, please, if you don't mind to just, first of all, how many members are in the community?
1,500
And at the community, or is that so?
in the community.
In the community, all right. And how many people have been affected by this addictions crisis totally?
Well, up to 30%, but
30% as people suffer from addictions, or is people whose families have...
addictions. And the number might be higher when you include the families.
And what existing resources exist at the community to provide some of the services that were requested?
We have our local health programs, NADAB, PFI, BHC, NAEPS, a couple other programs, but we get the assistance from Quest Health. They send in their people, the mental health therapists, knowledge keepers.
Can you describe in some detail what it's like for those folks to try to have to deal with methamphetamine addictions in your community?
The people that we talk to that are addicted to or using meth, their lives are lost. They don't know where to go. They don't know who to turn to. But we try to provide that direction. But it's so hard for them to go get that help. But we're always there. There's health staff there. There's Quest Health there. And Kim, KIM. They're in the picture. But very afraid that when people start coming off the meth, they go into severe depression and start having suicide ideations, attempts. We're not guessing at this. We've learned this stuff from the users themselves because we talk to them. They've opened up to us. They're asking for help, but we cannot provide all that help that they need. We need an emergency detox center in the community. We need a long-term treatment program in the community. We need mental health therapists, nurses, public nurses, doctors to come in. These people sometimes don't sleep for 3 or 4 days. They don't eat for 2 or 3 days. Their physical appearance is very, very shocking. So we need help now.
How many, forgive me for asking, but how many suicide attempts or completions have there been since early October when you first raised this?
There are attempts and ideations on a daily basis. Just last night, we got a text from our colleague back home, another counselor, that he was up and out in the community till 3 a.m. because somebody was trying to hang themselves. That's a daily occurrence.
Chief Merrick said that the ISC has denied the request. What was the reasoning for the flat out denial?
All they want to do is keep talking and talking and talking. We've been asking for help for years and years, and that's all they want to do. We'll do a study. We'll do an assessment. Now it's the time to act. We've been asking for many years. We need them to provide us the help that we need.
The emergency response teams, the nurses, the addiction street workers, how many staff total are you requesting on an immediate basis?
An army. We need people. We need maybe 5 to 10 more therapists to come in. Maybe we only have 2 nurses at the nurse station at some weeks. We need a full staff of nurses. We need the RCMP to work with us to help us combat the drug issue. They're nowhere to be seen.
What do you mean by the RCP is nowhere to be seen?
We keep talking to them, providing them with the information, and they say can't do anything. I need proof, but we do send them a lot of information, and there's no movement from the RCMP at all.
So you're saying the RCP are not interdicting anybody coming in or researching anybody flying in?
Nope. We basically have to do this by ourselves with the help from Kim, Quest Health, AMC, MKO, KTC.
And forgive me, what is the breakdown between the help you need between ISC and from Manitoba Health or rural Northern Affairs?
It's been stated here at the press conference, we need resources. Let us do our own programming. We get the information from the users on what helps them. We can implement those ideas that they give us. We can take them on a land-based healing. But first, we have to deal with their withdrawals and have a detox center in the community.
So what is the immediate request from the province specifically?
More doctors, more people that are with mental health, even the physical health, emotional health. We need therapists. We need doctors, and we need them, because they're the ones that contracted the RCMP in Manitoba. We need them to push their employees to help us.
Have you had any conversations directly with the province in the last month?
Not in the last month, but we had meetings prior, not only myself, but other communities. I've talked to the province, to the ministers, that we need this kind of help in the communities. But I just want to say, our immediate needs are, like I said before, a community talk center. We need at least, I don't know, 100, 150 beds. We need a long-term treatment program. We need a safe house for children that may be apprehended because their parents may be on the drugs. Right now, we're trying to go into holistic healing, traditionally and with Christianity. We're trying everything that we can think of. We've done a bit, now we're trying to do more. Public health nurse, we just got notice that we're getting a public health nurse, but we've been asking for a public health nurse for 10, 15 years. And today are very proud to tell us that they're supplying a public health nurse, but it took 10 to 15 years to get one. We need security guards, we need patrollers to make sure nobody freezes to death outside. We need people to patrol the community. We had this with COVID, security, community security. We need this community security for this meth crisis, this addiction crisis that we have. We need to develop some kind of program that will help people who are addicted to meth. Professionals say there's not really a program for meth, but we believe the users can help develop that program to help them. And that's what we want. We want the resources so we can implement them.
Picture of